From the Central Western Washington area, Choice Regional Health Network presents the Equity Circle podcast, a place for information with integrity, accountability, and innovation. Enjoy the episode.
Good afternoon, listeners, and welcome to another episode of the Equity Circle podcast. Our guest today has been on the show before, Dr. Mary Ellen Biggerstaff with Birdseye Medical. Welcome back, Mary Ellen.
Thank you very much.
Great. For our new listeners, please remind the audience again about what you do at Birdseye and what kind of services Birdseye provides.
Yes, thank you. And I am a family nurse practitioner with a degree in public health. I work part of the time with Birdseye Medical, which is founded here in where I am in Olympia, Washington. We're an organization that was started by a local internal medicine doctor who really just wanted to help gather community resources and put people together to help with COVID and help to combat COVID. And we started off with doing vaccines, and now we are continuing to do some vaccines, but spending a lot of more energy getting people preventative and treatment for COVID.
So preventative treatment, that's interesting. And I'm understanding now that some of the concern is that, many people have underlying health conditions, and so vaccination is perhaps not possible, or they have had severe reactions in the past to vaccinations. And so some of this is because of being immune compromised, isn't it? So what would you say are some of the options that you're looking at to help these people?
Yeah, and I would say these, we still are encouraging people to get vaccinated. So these treatments are available whether you are vaccinated or not. If you are vaccinated and high risk, then these treatments are absolutely something that you should be considering. So yeah, there's a couple different options. There's antiviral medications, Paxlovid and then there's monoclonal antibodies. And then there's also a prophylactic, what we call a preventative medication monoclonal antibody treatment that we can give to people that are very high risk at developing complications, hospitalization, and death that can help prevent those worst case scenarios if they do become infected.
Okay, so tell us a little bit more about the monoclonal antibody treatment in layman's terms.
Yes, I'll do the best that I can. So there's a class of medications that have existed before now, or treatments called monoclonal antibodies. And what particularly these class of medicines, there's several different options available, but they attach the antibody to a spike protein that exists on the virus that helps prevent that virus from entering our cells and replicating. So the monoclonal antibody treatments right now can either be preventative, so you give it to a person that doesn't have COVID at the time, or an early treatment to help prevent severe infection.
Okay, and what is the latest drug out there, monoclonal treatment that you have right now or that you know about?
Yeah, and that's a good question, because I have to pretty much check almost on a daily basis. We have updated emails, and we have a pharmacist just help screening for us, because it changes fast. Because not only are these medications being released once they get emergency authorization, but with the wave after wave of different variants, we're having to constantly look and see what is the most effective. One treatment that we just had actually dropped off and is no longer considered effective. We're not giving it right now. But yeah, so Paxlovid is the antiviral medication, and that's actually an oral pill that people can take at home if they have vaccinations. That's not a monoclonal antibody. But then we also have IV infusions that we can give to people when they're early on in their COVID infection. Some of those are, I'm going to work hard to pronounce them correctly, but Betlamavir and Matlovapir. Sorry, I'm not even sure that's exactly right. I've been practicing and trying, and they still trip up my tongue a little bit. And then there's a medication called remdesivir that they give in the hospital, but only for people that are hospitalized.
I see. Okay. Now, are these treatments, are they available for children as well as adults, or is there some sort of cutoff?
You do have to be age 12 or older. Yes. Yeah,
Okay.
there's certain weight requirements in age 12 or older.
Okay. So you mentioned that these are only approved for emergency use. Is that correct?
That is true. Like pretty much everything that we've been dealing with COVID, the FDA is looking at risk versus benefits in a compressed timeline because we need the treatments now. It's not like hypertension where we can wait, a year to study it effectively because there's other treatments available. We don't have these treatments available. So everything is coming through under emergency use authorization, which means it's been studied. I mean, they've looked at that and they've made sure that it meets some basic safety requirements, but it does not have full FDA approval. That is correct.
Okay. Are there clinical trials still going on then with these preventative measures?
Yes, absolutely. And then, like I said, when we are getting, weekly, if not daily updates on what they're finding out about how effective it is, side effects, etc. So yes, it's ongoing and continuously being studied. Absolutely.
So are pharmacies able to give out this sort of treatment, or is this something that individuals really need to talk with their health provider about?
Yes, it is. That's an excellent question because it is such a new treatment. Currently, you can get Paxlovid, can be dispensed by a pharmacy, but for all these medications, you would need a provider ordering them. Often people, if you find that you are a candidate for one of these, either because you've just tested positive or because you would be a candidate for Evusheld and you're interested, you can talk to your primary care provider if you have access to them. Not everybody does. And one of the things that Birdseye does is trying to help with equity is we do have on-call providers so that if you, and we're kind of rolling that out throughout the entire state, so that if you know that you need this or think that you're a candidate, but you personally do not have a primary care provider or you can't get in for a long time, you can call and schedule an appointment with one of our providers to get these things ordered.
Oh, that's very good to know, Mary Ellen. So if someone doesn't have a provider, what is that phone number that people could call in order to try and get that preventative medicine?
So our main office number is 1-360-688-7044. And people can call that number and you can be connected and you can potentially have an appointment with a provider to discuss your eligibility for that medication.
Wow. This is a little bit off topic from that. I know that Birdseye Medical has been working with several of our partners in the region at vaccine clinics, providing all of the vaccines and the boosters. Do you have, or would you be able to provide information about these other preventative measures for people with immune compromise, or just who are possibly allergic to vaccines? Do you have that information that you can provide at these clinics?
That is an excellent question. I don't know specifically what the nurses and staff would have on them, but we as an organization, we all meet together at least once a week to kind of talk about what services we offer. So anytime, and there's always medical staff and nursing available at our vaccine clinics, so somebody should feel free to ask about them. We have been handing out information. I know about the Evusheld, especially now that people are getting their higher risk people are getting their second round of boosters. But if there's nothing right in front of them, anybody can ask any of our staff, and we will help them get the information they need. Yeah, because we continue to do vaccine clinics around the state and really reaching out and trying to reach people that maybe are a little bit more vulnerable or underserved, especially.
That's great. Do you think that this information is also available at the many of the county health departments? Are they able to help with inquiries coming in from people who may, as you say, not have a provider right offhand?
I think that's going to vary a lot county to county. You see some public health departments at the counties are really robust and have a lot of resources, and some just don't have very much. So it's never a bad place to check out their websites and see what is available. And we do partner with a lot of counties, but I think that would be one area people would give that information. Yes. But I don't know for sure, depending on which county you live in.
Right. That's understandable. So kind of as we start to wrap up with this conversation, I guess it would be a good idea for people that may feel like they have this kind of immune compromise to discuss any of these options with their health provider if they're able to, and see what might fit best for them moving forward.
Absolutely. And one thing that I would say is, so there's two options that we're kind of talking about. We're talking about medication that you need to take early on if you find out you're infected with COVID. And that is as simple as potentially a pill, Paxlovid, that you could pick up at your pharmacy and get and take to help reduce hospitalization and death. And then if you're very high risk, so if you're somebody that has HIV, on chronic steroids for immune suppression, or if you have had an organ transplant of some kind, or you're in cancer treatment, those are the people that should be eligible to get Evusheld. And absolutely, people should really be thinking about that, as it can really reduce hospitalization and death.
So Evusheld is a brand name for the monoclonal antibody that we're talking about right now?
Yeah, it's one, and it's actually a combination of two monoclonal antibodies. But Evusheld is the one that is preventative, whereas the other ones that I mangled the words a little bit are monoclonal antibodies, but you get them when you first have a COVID infection.
So great. So if people are proactive and they test positive, although they may not have any real symptoms right away, this Evusheld would be a good alternative to go ahead and start trying early on.
Actually, and good. This is good to clarify, because it's super confusing. There's a lot of names, a lot of information. Evusheld is for people that don't have COVID but are very high risk. So that population, okay. Cancer patients, HIV positive, organ transplants where they're on immune suppressive medication. So people that have really complicated histories and bad immune suppression, they would take Evusheld, which is a monoclonal antibody, but they would get 2 injections of that, and that would help boost their immunity when they do not have COVID. So it's for people that do not have COVID.
Okay.
Paxlovid and some of the other monoclonal antibodies that I mentioned are for treatment if you're high risk. That's broader high risk. So people that are diabetic, obese, people that are over the age of 65, maybe have COPD, asthma, lung conditions. Those people are eligible to take the Paxlovid or some of the other monoclonal antibodies when they first find out they have COVID. So yes, if they test at home, they're feeling fine, but they know that they are high risk, those are the people that should be getting those treatments. So kind of talking about 2 branches: preventative treatment and then early treatment for when you are COVID positive.
Right. Okay. Thank you for straightening that out, because I was even getting a little confused by that. But anyway, for the sake of our listeners, Mary Ellen, do you have any other direction or guidance for people that may still have concerns about any of these treatments? Do you have any final thoughts on that?
Yeah, it's that one thing that's been interesting, though, I would say, is that the monoclonal antibodies have not been as politically divisive, that treatment, even though it's under emergency use. So that seems to be that people that are resistant to vaccination for some reason are much more open to that, which has been good that they want to do that. I would just encourage people, they always have every right to ask questions before they're taking a medicine or given a treatment. And whoever is prescribing that medication can do their best they can to help answer that. And whoever's administering that, they have every right to ask questions and understand. If they want to read a little bit more, I recommend the CDC or the State Department of Health has good information that you can look up. Our website, Birdseye Medical, has a little bit of information on that. And then just talk to who the prescriber is. But people can certainly ask questions, because as we've already discovered, there's a lot of information, and even those of us that are professionals, sometimes it can be a little overwhelming to make sure we understand everything clearly.
Yes, thank you so much, because I know it must be very challenging for folks like yourself, where it's constantly changing and you're constantly getting information, and yet your mission is to really get as much information as well as the treatment out there as quickly as possible to folks who are at risk from a health perspective. So I'm sure that we really appreciate that. Do you have any final thoughts that you'd like to share with the audience today?
No, just really an emphasis that I think people have not heard about these treatments as much as they had about the vaccines rolling out. And, COVID has improved a lot, but the death rate around the US is still, close to 700 people a day are dying of COVID, and most of those people are high risk. So just really encourage people to, if they're curious or they want to know more, to find out more and really realize that this is an option for you if you are a high risk patient and you're worried about COVID still.
Oh, and one final question that just came to mind is, again, because these are not fully FDA approved except for emergency purposes, are they still free to those who need them?
That is a fantastic question that I actually do not know off the top of my head. I know that I'm going to say that I believe, yes, that these are usually covered. I know the Evishield is our visit is covered. I think anybody that's doing that should probably just double check and ask, but I believe there are definitely supplements. I don't know if it's 100% covered for everybody.
Okay. So good.
Thank you for asking that. I wish
Yeah.
I knew absolutely 100%.
But no, that's a good tip to remind our listeners to always check and make sure that, that these kinds of medications, preventatives, are covered by your insurance if you have it. And if not, there are resources out there available to help you manage that in our efforts to promote health equity among our audience. Well, I would really like to thank Mary Ellen for being with us at such a short notice today. And I'd like to thank everyone for listening to another episode of the Equity Circle podcast. And please consider subscribing through Apple, Google, or Spotify. You can also visit our website, www.crhn.org, to listen, and you can also find us on Facebook, Twitter, and LinkedIn. And remember, equity equals progress.